Hi, my name is Alyssa, and I'm joined by my partners Annie, Kayla, and Diana. And today we would like to shed light on a rare developmental birth defect called Schizencephaly. Schizencephaly is a rare condition that affects brain development in infants. During fetal brain development, cells undergo a crucial migration process, moving from one part of the brain to another. However, sometimes these cells don't migrate properly, resulting in abnormal slits or clefts in the brain, and when this occurs, it is called schizencephaly. These clefts can occur on both sides of the brain, which is bilaterally, or on one side of the brain, which is called unilaterally. And unilateral schizencephaly is what we will be focusing on today. Remarkably, schizencephaly is quite rare. It affects only about 1 in every 64,935 infants born in the United States, and additionally, there are two types of schizencephaly. There is the closed lip schizencephaly type, and in this type, the cleft is fused, which prevents cerebrospinal fluid from passing through. On the other hand, in open lip schizencephaly, the cleft is not fused, allowing CSF to pass through the ventricular cavity and subarachnoid space. On this slide, you can see more example photos of what clefts look like in MRI images. The exact cause of schizencephaly remains unknown, but it has been linked to prenatal exposure to teratogenic agents or viral infections like cytomegalovirus or Zika virus during pregnancy. In rare cases, schizencephaly can be inherited, often associated with genetic mutations in specific genes. As for the risk factors, mothers who have stroke in utero, substance abuse disorder, ingesting prescribed warfarin, injury during amniocentesis, hypoxia, being under the age of 25 when pregnant, and maternal trauma can put a mother more at risk for having a baby with schizencephaly. Schizencephaly's signs and symptoms can vary significantly based on the size, location, and type of the cleft. If the unilateral clefts are open lip, the delay will typically be more severe, and sometimes individuals with these clefts might not experience any symptoms at all. If one does experience symptoms, common symptoms include seizures, cognitive delay and impairment, motor developmental delay, delays in speech and language skills, partial or complete paralysis, intellectual disabilities, hemiparesis, spasticity, strabismus, hydrocephalus, the absence or underdevelopment of the corpus callosum, and understanding these variations in symptoms is vital for tailoring treatment and support. Infants might experience infantile spasms, seizures, developmental delays, or hydrocephalus when there's an abnormal buildup of CSF in the brain, and that might require a VP shunt. In childhood, children might still experience seizures, developmental delays, and they also might need a VP shunt replacement. Sometimes adults might not experience any symptoms in infancy and childhood. However, there might be a late onset of symptoms where they might experience headaches and seizures later on in adulthood. And in rare cases, individuals may also experience paranoia, irritability, and impulsive spending. When working with this population, OTs should be mindful of the following precautions, such as hydrocephalus and signs of hydrocephalus. Also, VP shunt malfunctions. OTs should also be mindful of seizure protocol and triggers, and also spasticity and hypotonicity. When it comes to the prognosis of schizencephaly, it's important to note that the condition itself doesn't directly affect one's life expectancy. However, certain complications arising from schizencephaly, such as seizures and hydrocephalus, can be life-threatening.
Next, I'm going to be talking about some of the common medications used to manage this condition. Anti-seizure drugs are commonly used to treat epilepsy, which is a symptom of this condition as it is a CNS malformation. Additionally, muscle relaxants can be used to address spasticity. As previously mentioned, in cases with hydrocephalus, a shunt can be placed to divert fluid to another part of the body. However, shunts can create complications such as shunt-related renal damage and endocarditis. Lastly, other surgery options involve reducing intracranial pressure. But again, some of the potential complications may be subdural hygroma, bleeding, hydrocephalus, empyema, and infections like meningitis. Because of the rarity and variability of this condition, it lacks a standardized medical treatment. As a result, interventions may include clinical trials, Developmental therapies, including occupational therapy, physical therapy, and speech therapy, as well as orthopedic treatments like casts or braces to address spasticity. Unfortunately, there is no way to prevent all cases of schizencephaly, but it is important for pregnant individuals to get regular checkups and take precautions to avoid infections and substances that may harm a developing fetus. Functional implications include delays in coordination from gross motor challenges, learning due to cognitive delays, and misalignment of the eyes, also known as strabismus. However, functional implications can vary. For instance, individuals with closed lips schizencephaly may be asymptomatic, meaning they will not experience any symptoms. In terms of associated precautions, individuals with schizencephaly may be diagnosed with cerebral palsy. Additionally, risk factors during pregnancy include substance use disorder, viral infection, hypoxia, amniocentesis, trauma, and taking prescribed warfarin. Because schizencephaly impacts the right and left cerebral hemispheres, the following areas may be impacted: cognition, language, especially speech, causing children to talk later, emotion, hearing, and vision may also be affected. As previously mentioned, impacted developmental areas vary case to case based on the size and location of the cleft. Those with small clefts may not have symptoms, whereas those with larger clefts may experience more severe symptoms and require lifelong support.
As previously mentioned, symptoms related to schizencephaly vary based on size, location, and type of cleft. Therefore, client factors affected will vary case by case. Symptoms related to cognitive delay and impairment can impact mental functions such as higher level cognition, sequencing complex movements, and emotional regulation. Motor development delay, low muscle tone or muscle weakness, and spasticity can impact neuromusculoskeletal movement related functions such as muscle power and tone, joint mobility and stability, motor reflexes, and control voluntary movement. Delays in speech and language skills can impact body structures related to voice and speech. And partial or complete paralysis can impact sensory functions related to proprioception, vestibular, touch, pain, pressure, auditory, and visual. And again, all of the mentioned symptoms can greatly impact a client's values, beliefs, and spirituality, as they may face loss in motivation and lack of meaning and purpose of their life, depending on how severe their symptoms may be. Considering the same symptoms that were previously mentioned, the following are performance skills that could potentially be impacted. A child's social interaction skills can be impacted by a delay in cognition and speech and language impairments. A child's motor skills can be impacted due to spasticity, low muscle tone, and partial or complete paralysis. And their processing skills can be impacted by cognitive delays and potential intellectual disability.
Due to the wide variety of symptoms and presentation in schizencephaly, there is a number of occupations that can be impacted by this condition. For this presentation, we will focus on the neuromuscular components and cognitive components. Three important areas under neuromuscular functioning that are impacted by the symptomology of this condition include low muscle tone, limited muscle strength, and spasticity, all of which affect participation in occupations. Individuals experiencing low muscle tone may have postural instability, joint instability, and lack of functional mobility, which could affect any multitude of ADLs, education, and play. Similarly, individuals with limited muscle strength may lack gross motor and fine motor control necessary for education tasks like writing, dressing, playing, and hygiene skills. Finally, individuals with spasticity may lack bilateral coordination and may be unable to perform bimanual tasks, impacting things like dressing, specifically doing dressing closures, hygiene, like brushing teeth, and toileting. Individuals with this condition may also experience deficits in cognitive and social functioning, which may affect occupational performance as well. Individuals may experience limited motor organization, which may include motor planning and sequencing, which will affect functional mobility, dressing, play, community mobility, and education. Individuals may also experience impacted processing skills, which may manifest in intellectual disabilities, delays in learning, and these could affect ADL and IADL completion, as well as education, and poses important concerns for safety and occupational performance. Finally, individuals with schizencephaly may also experience language delays, specifically aphasia, which could impact communication skills and create deficits in the occupation of social functioning. As we can see, this condition affects many areas of occupational performance, demonstrating a dire need for OT intervention. When working with children in this population, OTs take on a diverse role, and interventions can include anything from ADL to IADL completion, communication, feeding, fatigue management, social participation, and even mental health. Interventions tend to focus on managing hemiparesis, hypotonia, seizure medication management, educational performance, and promoting independence and safety in self-care skills. When considering which frame of reference would be most appropriate for working with children with schizencephaly, we decided on 4 main frames of reference. The first frame of reference is rehabilitative. Because schizencephaly has no known cure, many interventions provided by OT services will include compensatory and adaptive strategies to promote independence in occupations. Another frame of reference that would be appropriate for this population is biomechanical. Like discussed previously, the major impacts on occupational performance for this population include hypotonia, hemiparesis, limited strength, and spasticity. Using a biomechanical frame of reference, we will guide interventions to target musculoskeletal symptoms to promote independence. Schizencephaly is not only a neuromuscular condition, there are also cognitive symptoms that need to be addressed by OTs. Using the co-op frame of reference, OTs will be able to address cognitive delays and intellectual disabilities in this population to promote learning and processing skills needed for occupational performance. Finally, when working with children with this condition, there is a high likelihood that they will present with developmental delays. As an OT, we can implement the developmental frame of reference to meet clients where they are at developmentally and provide interventions that will progress them forward. There are a number of assessments that would be appropriate for this population. A few that we would like to point out include the Peabody Motor Scale, which would be appropriate for individuals aged 0 to 5 and specifically focuses on gross and fine motor functioning. The Brensky-Oscar-Sky test, also known as the BOT-2, is a motor proficiency test for individuals aged 4 to 21. It also addresses social participation, which we know can be affected by this condition. When assessing cognitive function for this population, the Dynamic Occupational Therapy Cognitive Assessment would be appropriate for individuals aged 6 to 12 years old. And finally, the Pediatric Evaluation of Disability Inventory would be an appropriate functional skill-based questionnaire to provide parents of clients aged 0 to 8 years old. These 4 assessments would ensure occupational therapists are able to assess both motor and cognitive functioning to best create an intervention plan that promotes functional independence in all occupations.
Differences in tone along with muscle weakness may result in poor postural control. Occupational therapists focus on increasing postural control as it is needed for reaching, dressing, feeding, and play activities. One intervention that can be done to increase postural control on a child with schizencephaly is using uneven surfaces like a yoga ball to stabilize the trunk in an upright position. Our goal is to increase head and trunk control to remain upright when standing or sitting, to improve dynamic and static reaching, to engage in feeding, dressing, and play activities. Another treatment strategy that can be used to treat a child with schizencephaly is neurodevelopment treatment, otherwise known as NDT. Occupational therapists use NDT to guide their evaluation of muscle tone and movement during self-care and activities of play. A key factor of NDT is to pay close attention to the quality of movement. Some of the factors that can be observed during an intervention are normalizing tone, therapeutic handling, weight bearing, and thoughtful setup of environment task. The goal is to increase functional performance associated with movement related to play and self-care activities.
If a patient presents with only mild hemiplegia, constraint-induced movement therapy can be used to possibly improve motor function of that weaker side. In some cases, patients with unilateral cleft schizencephaly have all their muscles intact, but their brain has to work harder to move that impaired side. In this video, you can see the OT is using CIMT to improve the patient's impaired side.
3 pieces of adaptive devices and technology that would be appropriate for this population include a walker, wheelchair, and an augmented alternative communication device. Due to low muscle tone, limited strength, and hemiparesis, many individuals with schizencephaly will lose their ability to walk independently. Providing these children with walkers and wheelchairs will promote independence and functional mobility. Depending on the level of the individual's physical disability due to the condition, an OT will need to decide whether a walker or a wheelchair is most appropriate. A common walker used by this population is the K-wide postural control walker. These wide walkers allow room for leg braces and provide postural stability through the upper extremity and posterior supports. If the child has an upper extremity paresis, a wheelchair may be more appropriate. These can be manual or powered depending on the upper extremity control and cognition. Another impacted area from schizencephaly is language and communication. An OT can work closely with a speech pathologist to provide and educate clients with an augmented alternative communication device. This can promote independence in occupations and social participation.
Depending on the severity of symptoms and motor delays, some potential referrals that might be beneficial are a speech-language pathologist, which they can work on any oral motor delays dealing with eating, swallowing, or oral communication. Physical therapists may also be beneficial to work on gross motor delays or motor delays in general to improve their balance, mobility, strength, and coordination. Also, neurosurgeons might be beneficial if the patient presents with hydrocephalus and they need a VP shunt.
Due to the rarity of this condition, it was quite difficult to find community resources within the San Bernardino area. 2 schizencephaly-specific support groups we were able to find are both online platforms. The Schizencephaly Family and Support Group is a private Facebook group for parents of children with schizencephaly. This group provides a safe place for parents to ask questions and share stories of successes and hardships, and provides a positive social network for parents of children with this condition. Skiz Kids Buddies is an online website for a nationwide support group for families, friends, peers, and professionals who work with individuals with schizencephaly. This website provides general information on the condition, networking opportunities, and other helpful resources. Families Empowering Families meets at the Rock Church on Monday nights in the San Bernardino area. This, however, is a support group open to all caretakers and siblings of children with any type of condition that may make life more challenging. This is a group that works to build caretakers up and provide social support in times of need. On behalf of our entire team, we would like to thank you for listening to our presentation.